respected chairperson, senior faculty, senior citizens in this August gathering, my dear friends. Very good afternoon to all of you. I am told to discuss a few matters regarding rehabilitation in the elder population. So I hope most of you agree with this photograph. So what I added is an overview because in 10 minutes I am aware that I can't cover whole rehabilitation. I will just try to answer the few basic questions about what rehabilitation in elderly means. I bring greetings to you from Shri B.M. Patel Medical College and BL University, where we have a geriatric clinic. This is a road less traveled. Not only the geriatric medicine, also the patient referred to the rehabilitation measures. So this photograph, I just want to convey that the whole road towards the geriatric medicine is taken by very less people. There are only 3 or 4 geriatric physicians here in this August gathering. And of course, patient referral for a rehabilitation mode of treatment is also very, very less. Though we have multiple modes of modalities of treatment in elderly population that includes palliative care, the respite care and the hospice care, also a rehabilitation is one of them. I just like to bring a notice to one of the old lady. She came to me with a history of fall and unable to get up. Her X-ray revealed that she already had a fall with a fractured neck femur 3 years back and is operated. And now she has developed a new fracture on the right side. So this lady was totally bedridden. And this, of course, apart from that, we see severe osteoporosis on X-ray. This is a lady who required rehabilitation measures. This is another old man which we had, sorry for the technical problem, we cannot play that video. He had bilateral Parkinsonism, and the moment he drops this hand, it starts shaking. And when I tell him to bring this hand again front, both hands start shaking. And it is such a severe situation. He is totally dependent on a caregiver for everything from the ADL to IDL. What he gets up in the morning till he sleeps in the night, everything of his life is dependent on others because he cannot use his hand because they are shaking severe despite the medical treatment. This is a person who requires rehabilitation. So what exactly is rehabilitation? So what we do in the process of rehabilitation, in the process of treatment of geriatric medicine, we like to emphasize 2 things. One is a recovery and second is an adaptation. We like the elderly to recover from the injury or the trauma that he has undergone, and if not, at least try to help him to adapt with whatever functional loss he has got for a good quality of life. So why rehabilitation? How it differs from the younger population? Because the older population has a low physiological reserve. They have multiple diseases along with it, and like comorbid conditions. And of course, acute illness leads to a disastrous presentation in them. So all these 3 factors needs rehabilitative measures for them to lead a quality of life. So what are the goals of rehabilitation? The main and most important goal is to help them live more independently or near independently. And most importantly, we have to help them to adapt to the situation that may have to come after sustaining injury, which they have to do in a differently abled person. And of course, we have to restore the individual to his or his fullest physical, mental and social capabilities. This was a front page article just recently had come on British Medical Journal. For every disease, we can't show the arrows. For diabetes, you go there. For the cardiac, you go there. For orthopedics, you go there. For neurology, you go there. And this is what is happening now, and they are land up with a lot of problems. So the role of geriatric physician here is to condense all these things to one point and make the person minimize the drugs and give a quality of life. So what are the indications? Which are the patients who requires rehabilitation? Those are stroke, Parkinsonism, hip fracture, amputation, arthritis, chronic obstructive pulmonary disease, and even patient who have undergone cardiac open bypass surgery. So what is required before a rehabilitation process begins is all those scales we have to measure. The most important is the motivation in elderly itself. is he willing to get up and go after sustaining an injury? The motivation in him itself is the most important factor that acts as a motivation as well as a barrier in success of rehabilitation measures in older population. And of course, we have to look for the medications. We try to do rehabilitation measures in elderly population and is taking antihypertensive, likely to develop orthostatic hypertension, and he may fall on the floor. So all these things has to be kept in mind. And we have two types of rehabilitation: is soft rehabilitation and second is hard rehabilitation. In most of the times we assess, we do counseling, do encouragement. Listening is the best communication skill. That is what the elderly people want a physician to listen to them. And of course, the hard rehabilitation measures includes the physiotherapy, the occupational therapy, the appliances, use of appliances, how best we can adapt to whatever injuries or whatever disability they have developed. Now coming to what are the barriers of rehabilitation. Amongst is, most of the time these diseases are hidden in the elderly population, like hypothyroidism, the occult depression is very, very important. Most of the times the rehabilitation process starts and the person is found to be depressed, and the rehabilitation process stops because of non-cooperation from the patient relatives, and of course the occult dementia also has a barrier in the patient undergoing rehabilitation. And I like to put it other way, that the patient rehabilitation to be successful in him, he has to overcome these barriers. Also a physician has to look for these barriers in him, because the person whom you try to teach how to use these aids, he may not remember. So that dementia and most of the times most of the drug side effects can hamper the use of rehabilitation measures in these patients. According to you, amongst all this team, who is the most important person in rehabilitation? It is a nurse. Is a nursing faculty who has a highest credit of a successful rehabilitation process in an older person. And these are the people who spend most of the time with the patients. They encourage the patient, and they will be knowing what about the caregivers, how they are treating, and of course they also help them keep clean, neat, and that has a feel good effect on an older people. So just a few tips for the person who has undergone an surgery for a hip fracture. Most of us may come across this because we are in a partnership with our parents, and so we may have to come across. So what we should do as a rehabilitative measure is, it starts in the hospital itself, the day he is admitted for acute care, and it starts in the hospital and it goes on along with him to the house where it can be done. Rehabilitation can be done anywhere, in the house, in the office, in the nursing home, in anywhere else, anywhere the elderly person visits, even sitting in the garden, the rehabilitation measures can be done depending upon the indications that are there. So what is done in at least a patient who has got a repair for hip fracture is, the ambulation should be done with the using of parallel bars in the hospital on the second or third day. That is the first. Importantly, even in post CABG, patients are told to climb the steps and come down. Especially in these patients who have undergone a hip surgery, the most important thing is he has to climb the stairs. The first step he should climb with the non-operated limb, and while coming down, he should put the operated limb first down. That's what we mean by up with good and down with the bad. So friends, the rehabilitation measures in a geriatric practice is basically a teamwork. The team constituted by a nurse, strong caregivers who are willing to help the elderly to overcome this disability, a psychologist, a social worker, occupational therapist, a physiotherapist, a dietitian, and after all, an additional geriatrician to make a rehabilitation measure more successful in elderly persons. So a few words for those who are very much young in the geriatric practice. There is plenty of research opportunities for rehabilitation studies to be done in older people, and there are plenty of funding agencies for rehabilitation measures. Government of Karnataka has come with an amendment that those who are trying to find the local methods to improve the quality of life of elderly are the studies have been funded, and of course there is an entity and a whole council called Rehabilitation Council of India. Those who are interested, you can attend this website. They produce a lot of papers, and they also have courses to do a rehabilitation courses in elderly population. So friends, the rehabilitation measures had not been much successful in our scenario, because most of the times it is a clinician who ignores the role of the importance of rehabilitation, and motivation in the patient is very, very important for a successful rehabilitation. Of course, the rehabilitation measures will definitely help to lead a near independent life, and it can be applied anywhere. Though it is a lengthy process, it is not costly as it has been understood by most of the people. And in rehabilitation measures, we try to use the locally available modalities to increase the quality of life and to reach the near quality of life. And the rehabilitation begins with the admission, stays during the process starts during the hospitalization, and it proceeds when the patient discharges to the home and starts working in the office. I thank you all for patience hearing. Any questions or any suggestions, I'll be welcome for this. Thank you very much.
Thank you, Dr. Anand. Because of the paucity of time and many of the people have to catch their flights, there are no more questions. At this, I end this session.
Sharing his words with us. Let's give him a round of applause. We request Mr. Amit Arora to honor the doctor, please.
The previous speaker had taken and...
Please come, sir.
Dr. Ambali. Thank you once again.